I'm letting them in.
Hi, everybody. Thank you so much for joining us. We will be getting started in just a few minutes as we wait for a few additional people. You should be able to see our slide. If you can't, please just let me know. So as you're waiting for us to get started, if you would just let us know who you are and where you're calling in from or zooming in from. We'd always love to know where our participants are coming from. Hello from Mississippi. We hope that you're doing okay and didn't have too many challenges with the hurricane and that your family is doing well down there and you guys aren't too hot with the steamy summertime weather. Okay, we're just going to give it just a couple more minutes if you don't mind. Looks like we've got a small crowd today. We've got Trisha calling in from Waco, Texas. Again, we hope everything's going well in Texas. All right, well, I think that we will go ahead and get started. Thank you all so much for joining us for our Innovation Thursdays. This is a project that we started back in July, and we meet 2 Thursdays a month. This week, we are happy to have with us Jada Shapiro, who is the founder of Boober and Birthday Presents. We will be talking about thinking outside the box when exploring innovations in maternal health. And I'm just going to give you a little bit of overview just so that you can kind of get a better sense of our organization. So we are the Maternal and Child Health Learning and Innovation Center. You've already put your name and your organization in the chat, so we certainly welcome that. We also encourage you to ask questions in the chat, and depending on how many we get or don't get, we'll either take them as Jada is chatting or we'll wait to the end of her presentation today. Sorry, I have everybody, I'm trying to move you guys around so I can see you a little bit better. So today we're just going to talk a little bit about the objectives. We're going to give you a short little overview of MHLIC, and then we will have Jada talk for about 30 to 40 minutes, and then we'll do our Q&A. It's also a very small group today, so we encourage you to just put your questions in the chat. So the objectives for today are to describe the maternal health issue addressed by having the founder of Boober with us. And we want to also be able to describe at least one feature that makes this particular approach in innovation in the scope of maternal health so important to the work that we are doing. So I'm not sure if you are familiar with the Maternal Health and Learning and Innovation Center, but hopefully you were able to join us for our national symposium that we held Monday and Tuesday. This is a project supported by HRSA, and we are going into our third year of a 5-year grant. We have a mission to foster collaboration and learning among diverse stakeholders to accelerate the evidence-informed interventions, advancing equitable maternal health outcomes through engagement, innovation, and policy. Our vision is to be an exceptional national resource center for eliminating maternal health inequities and improving the well-being of all families in the U.S. Our charge is to build a nationally prominent resource center to house training materials, online resources, and communities of practice. This Innovation Thursday is one of our innovations and one of the things that we hope will be housed and available to others even after today. We also want to be able to expedite the translation of knowledge to practice through training, technical assistance, and capacity building. So as you all know, being on the ground and working with maternal and child health, it's not always easy to figure out how to get from A to B. It's not always easy to figure out how to translate your knowledge and your skills and the experience of the evidence-based program into what needs to happen on the ground. Our contexts and our environments are always changing, and they're very different. Just thinking about our Mississippi and our Texas folks today, two very different states that have very different challenges. So that's part of our charge. We focus our work in 3 areas: innovation support, policy, and engagement. And this project is part of our innovation support core. And what we do is we build capacity, we connect and we collaborate. We have national leadership that we work with and works with us, as well as us working with them. And one of the main things that we do is we find, we share, and we develop needed resources. So that's kind of one of the ways that our Innovation Thursdays really came out of development. Was there's a need to share best practice and innovative ideas that are happening that maybe not everyone knows about. And we want to make sure that we help to spread that word and get information out to those that need it. We have maternal and health practitioners. Those are part of our audiences. We put together training, resource dissemination. We also provide technical assistance. This could be for any state or territory in the U.S., any public health or maternal and child health practice. We also have a number of grantees, which are called our Maternal Health Innovation and RMOMS programs. These are a certain number of states that have been provided funding separately through HRSA, and they receive more tailored and intensive technical assistance, coaching. They have additional opportunities for peer learning and learning events. Texas is actually one of our RMOMS states, but Mississippi is not at this point, but we are crossing our fingers for additional funding in the coming years. We have an amazing team of over 30 different individuals and organizations that work with us, and none of this work would be possible without them. I'm housed here at the University of North Carolina in Chapel Hill, but we work with all of these different partners on a daily and weekly basis to ensure that our resources, training, and technical assistance is done with an equitable lens and is widely available to all of our audiences. And so our partners are critical to the success of this project. So, as I said, the first and third Thursday of each month, we began this Innovation Thursday. Today is September 2nd, and we are hosting organizations who are thinking outside the box and kind of shaking things up. And so we do encourage you to let us know if you've heard of an innovation in your state or your town and maybe want to share it with other people. That might be something that we can certainly talk about after. We'll provide Allison's information to you. And now I would like to introduce our speaker and presenter, Jada. Did I get it right?
Yes, it's Jada, and I thank you.
Jada. So Jada Shapiro is a maternal health expert and the founder of Boober, where expectant parents and new families can find classes and on-demand expert care providers, on-demand expert care providers and pregnancy to postpartum. She founded Boober to empower parents to positively transform their pregnancy, birth, and postpartum experiences and outcomes through expert education and easy access to qualified maternal health care providers. She's also the founder of Presence Day Birthday Presents. Sorry. I just lost my place. Services, which is New York City's most trusted source for birth workers, worker training, and expectant parent education. Birthday Presence has supported over 20,000 parents since 2002. She is both a birth and postpartum doula, a childbirth educator, a lactation counselor, a birth photographer, mother, and stepmother. She has helped thousands of parents prepare for birth, has assisted hundreds of births herself, and cared for first-time parents, A-list celebrities, and everyone in between. She advises leading actors about childbirth and pregnancy for major films and is a sought-out media expert on pregnancy, childbirth, postpartum, lactation, and newborn health, as well as parenting. She's a graduate from Wesleyan University with a double major in American Studies and Dance, and focused her senior thesis on the medicalization of childbirth in America after discovering a fascinating book about childbirth in the library. She witnessed her birth a few years later when her dear friend invited her and 19 other people to photograph her birth at a freestanding birth center. She is the mother and stepmother to 4 girls aged 11 to 15. We are so thrilled to have you here with us and so excited to learn from you. Please take it away.
All right, thank you. So I'm Jada. I did decide to go back to my background, even though I know you're all apparently seeing Boober backwards, but my other background also just wasn't working. So here we are. So technology, but it does face the other way normally. So welcome and thank you so much. I'm gonna go ahead and share my screen, and it looks like somebody's in the waiting room as well. So I'm gonna share and then just want to make sure that you can see this, but you don't see my notes. Am I sharing properly? It's okay, great. All right, so we're just going to talk a little bit overview about me and my company and the pre, peri, postnatal healthcare system in the United States. A little bit of a landscape of a broken system, some signs that our system's not working and barriers facing families and how we got here. Overview of how we can make it better from, who are the stakeholders and the expectant parents, the gap care providers, the government insurance companies, some of the innovators in the space, my grand vision for reproductive health, and then just, take some questions. So thank you for that intro and for telling everybody about me. I kind of got a lot of it. So here you can see, just to give you a little picture of myself. I am Jada Shapiro, founder of Boober. I am a maternal health expert with 18 years of experience in this field. And I did found my first company, as you mentioned. I founded it in 2002 and grew it into New York City's top childbirth education and doula training center. So as you mentioned, helping over 20,000 parents really get prepared for birth, and also helping thousands of birth workers train for a career either as a doula, or now in more recent years, we train lactation counselors. So you see me here at the top with my daughter and my 3 stepdaughters. So we have 4 girls, age 11 to 15. I did birth one of them, but I was in this field for many, many years before I gave birth, which I think really positively influenced my understanding of labor and childbirth. And I think is one of the things that actually would be the most powerful way to change, would be getting more and more to change the American maternal health system, get more and more people to actually see and witness childbirth earlier in their life. One of the problems that we see is that people are not learning about childbirth until they're pregnant. So that's me and my kiddos. You see me at my studio, which we had to close in the pandemic, but we did have a studio for many years in New York City where we would bring lots and lots of doulas, parents, all sorts of people together. So I'm sitting there with a bunch of doulas at one of our doula lunch and learns, which was great. You see me at a very early birth as a doula a long time ago with short hair, and down below doing some lactation counselor work. So I really have gone through lots of different phases within the childbirth field. And I think it's really important and compelling, as you and whatever you all do and whoever's watching this, and potentially people who are running hospital systems or providing obstetrical care or midwifery care, that we really look at it's not just pregnancy, it's not just birth, it's not just lactation, it's not just postpartum. Those are all part of a continuum. And you can really even expand it out into sexual and reproductive health and education well before pregnancy, right? And that could flow into after having a baby and postpartum, and understanding that then there's a next cycle of the menopause cycle. So there's a really large reproductive health cycle. And I think in this country, we really chop things up. So I'm going to encourage people to start seeing this as all part of a continuum. So just a little bit more on Boober classes and on-demand care for pregnant and new parents. We've matched over 7,500 customers to care, which has been really wonderful. Many fantastic reviews, because I think people, when they feel cared for and they find support and care quickly, and it's amazing, it is life-changing. And, Boober really grew out of my first company, Birthday Presents, that we were talking about. It was driven by a market demand from my desperate customers. So I had all these childbirth education customers. We used to give I would give out a list of lactation consultants, right? I would teach the lactation class and be like, here's a list of great lactation consultants that if you need somebody, you can call. They were not getting the help that they needed. They couldn't get it fast enough. I noticed several years ago, it started to get more and more, where I would get phone calls like phone calls to the company, texts, all sorts of reach outs going like, I'm desperate. I called every lactation consultant on the list and I can't find anybody and I'm giving up. I don't know what to do. And I thought, in this day and age, when you can get your dog walked on demand and you can get your hair done on demand and get your makeup and all of that, like, how is it possible that we don't have the ability to get the postpartum help that we need to thrive? I was seeing parents spending lots of time trying to find this help, spending lots and lots of money on it if they had it, also seeing lots of people who wanted this kind of support and couldn't necessarily pay for it or access it, which is another component of what we need to talk about. And I really just saw this opportunity, started giving out my cell phone number on postcard to all of our students and was like, just text this number when you have a baby if you're having any kind of issues, and will help. And text they did. And I would get all sorts of crazy texts like, my boobs hurt, or I'm in pain, or help, and they thought I was a robot and I actually was a human. And so I would text them back and I would call them and talk. And what was so amazing is just contacting people right back, connecting with them right away calms people down. A human voice, not always, a lot of people prefer to text, or a human texting, connecting with them and telling them that it is hard, validating what they're going through, and also that we're going to get them care. Right. And so I started texting. I knew all of the lactation consultants in the city, and I would just hook them up with people that I knew in their area. So it started very informally. And now it has grown into what we like to call a marketplace, or a two-sided marketplace, right? Where you have a place where parents and the providers can meet and find each other, right? So we're really building Boober to be the first place that people turn to when they think about having a baby. We want them to come there to get all of their education, and to be able to find the support that they need quickly and when they need it. So while we started, and you can see the name came from the lactation side of things, we now match people to birth doulas, postpartum doulas, lactation consultants, mental health therapists who focus on pregnancy to postpartum, pelvic floor therapists, and on. And so we'll talk about that a little bit more. And we also train providers, and Birthday Presents is still functioning highly. It's just now shifted. We've shifted a lot in the pandemic. So Birthday Presents is now for birth worker training. So anybody who is looking to become a lactation counselor, or looking to become a birth or postpartum doula, or is a doula or birth worker who wants to get additional training in various things like trauma-informed support, circadian rhythms and sleep, all sorts of different things that are of interest to birth workers, understanding the pelvic floor. And we also at Birthday Presents provide scholarships and pay what you can spaces to people who identify as BIPOC, Black, Indigenous, or people of color. So a lot of opportunities for education and learning. And then Boober is all parent facing. So just a few images of a birth that I attended, as I want to talk a little bit about, really the impulse for starting Birthday Presents, or how I got into this work in the first place, is that I saw an incredible unmedicated birth with a midwife in a freestanding birth center. And this is another birth of a friend that I photographed, but the very first birth that I went to changed my life. And again, like I said, if more people, and I think more people in the medical field, and I don't know how many people might be watching this who maybe are in obstetrical care or have been trained as an obstetrician or have never seen an unmedicated physiologic birth that just happens on its own with no complications and problems, it is really compelling and really life-changing to see. And I think that really should be part of the requirement of training, that we would see what birth really may look like out when it's left on its own, safely supported, of course. But I went to this birth that was at a freestanding birth center in Baltimore, and my friend had 20 support people. Okay, there were 20 of us there. And I don't know how many of you have been to a birth with 20 people there, but I've been going to lots of births ever since, and I've never seen that since. But it was a real celebration and an experience. And she labored in every position under the sun, right? She used a shower, she used the bathtub, she used a birth ball, she used a bed. She walked around, she stood up, she leaned forward, she laid on her side, she squatted, she laid on her side, she laid on her back. I mean, she really did everything. And she also ate and drank as she wished, a little bit here and there, right? She had support as she needed it, people touching her, people talking to her, people who she wanted there. And it was nothing like what you see on TV, or in the hospital. And it really opened my eyes to what birth could be for a low risk person. And it also opened my eyes to what, even if you have a high risk birth or you need to be in a hospital because you have situations that could potentially lead to complications and you need to be monitored really continuously, it showed me about respectful care, and it showed me about patient-centered care, it showed me about family-centered care, and it really demonstrated how when you connect with the person in labor on a human level and you speak to them and you listen to them and they feel heard, even if they have a highly interventive birth, we see a completely different experience on the other side of giving birth. That even if everything that they didn't want to have happened when they were respectfully addressed about it, unless it's an extreme emergency situation, it's a completely different story. So then I went to a second birth. I came back to New York, and this time a friend was pregnant. I said, oh, I'd been to a birth before. Like, can I come photograph it? I'd love to be there, because I actually photographed my first friend's birth. My mother had just given me a camera. I was very interested in photography. And so I started, kind of came in that way. And so I went to photograph this second birth, but I ended up being my friend's doula. I didn't know the word yet. I was just there. I held her hand. I massaged her back. I was just a person who was present and caring. And I didn't necessarily know what I was doing, right? Or feel that I contributed all that much. But she actually said after, she was like, that my being there helped her get through a very difficult and intense experience. And part of how I came to, name my company Birthday Presence actually was because that birth experience reminded me that, well, my presence was the most important thing. And that's something I teach to all of my students and to partners and anybody going to a birth, is that if you love and care for that person, your presence and your continuous presence and staying there makes a huge, huge difference. And that's something we'd really like to see built into our maternal care system. We know that support, and ideally a great support from a doula, we'll talk about that, but whoever, allowing people to have who they need to be there makes a big difference for them. So after attending that second birth, I went to a birth conference that was in New York City on the Upper East Side, and learned a whole lot from that. And somebody saw me from there and said that you get off at my subway stop which was bizarre because it was very far away, totally different neighborhood in New York, and they recognized me. And I was like, yes, I do. Anyway, she said, I'm having a doula training in a few days. And I was like, what? So that's where I learned really about doulas. And she said, I'm bringing this incredible person in to train, and it turned out to be a few blocks from my home, and it turned out this person lived with somebody I went to high school with. So I said, okay, I'll do it. And I went to this birth doula training, and it just blew my mind what I had to learn and what I needed to unlearn. And I felt like I learned this incredible secret. But of course, what I learned was pretty standard in almost all countries historically, and certainly all cultures throughout all of time. So like learning about all of these birthing positions, learning about support, learning that people move and change, and they don't just lay down in one position, and learning that there is a world of people who may look forward to giving birth or have a transformative experience. Not that it's not intense and maybe the most painful thing in their life, and certainly can be, and can also be traumatic and all of these things, but that there was a different lens at which, you know, you could look at birth, and really in a way that we're keeping birth safe as well, but also allowing people to do what they need to do to get through that experience. So I started telling everybody on the planet that I had just gone to this doula training and how amazing it was. And everybody connected me to pregnant people, and they just kept showing up and wanted me to be their doula. And so I got a really amazing education early on going to births. And then soon after that, I was too busy really to take on any more births. And I started helping these people who needed a doula, but I couldn't do it, match them to doula care. And I realized that, you know, so that was one thing I've been matching to doula care, matching people to doulas in an offline way for, you know, almost 18 years now. We're just now starting to use technology to make it much easier for the parents to find the care that they need. So, you know, one thing I realized though as a new doula was that expectant parents are deeply unprepared for childbirth. And that's what I really found. And I would be meeting people at 36, 38 weeks and having these prenatal meetings, and my clients had no idea if they didn't know their choices and options where they were giving birth. And most people in New York are giving birth, and in the US are giving birth at a hospital. So they didn't know what the expectations were, what the rules were. They didn't know if they were allowed to try different positions, even though all the hospital beds move in different ways to allow birthing people to squat, be on their side, lean forward, all sorts of options, or how every single bed is designed. Rarely used in that way. And so parents didn't know that. They didn't know if they were allowed to eat or drink in labor, which is so interesting because, for instance, at our hospital, which used to be, is now called Mount Sinai West, used to be called St. Luke's. So at the time at St. Luke's, we had a birth center on floor 11 and the regular labor and delivery on floor 12. And on floor 11, anybody could eat and drink in labor if they wished, right? They didn't have to have an IV to keep them hydrated. But on floor 12, for a time, you weren't allowed to eat and drink in labor. And obviously people were not dying of eating and drinking in labor on floor 11. It was just part of the norm of birth center norms. And so over time, we'll look at these kind of things and go, oh, why is that? What did the studies show about eating and drinking in labor? And most, seem to show that you can eat and drink it in labor as needed, and that people actually don't eat giant amounts of food when they're in the throes of labor, but they do need some nourishment or broth, or they choose to have some extra energy. And it's amazing. The standard of care is so far apart in New York, where I work with a ton of obstetricians who allow eating and drinking and several who don't, and it's just not consistent. We're not really following the evidence. So that's something that is really challenging for parents. So as a doula and having doula care, I think I became super passionate just about educating people about their options, right? Did you ask how you could be monitored during labor? Did you know there's different options if you're a low risk person? It's possible you'll have to be monitored the whole time, but maybe you don't. And let's talk about how that could work, right? So that's just a little bit about me getting into it and learning and being witness to all of these incredible different kinds of births. And I've been to so many different kinds of births, and every single birth has its place. So I want to be really clear that I'm not advocating that we don't need intervention in birth. We absolutely do to keep birth safe, but we also know that we are at a level of extremely high intervention in birth, which has many risks and complications and problems for families as well. So just a little bit about how it works, or how it ultimately works, as we're still building out our tech, right? How it works right now is you can either text, which is really easy for parents, or you can fill out a form and people just make a request. And we have care connectors that are live that speak to the humans, the parents, if they want that. And most of them do, because they don't have anybody anywhere else who is spending the time talking to them. And I want to stress that it's really important that hospital systems, obstetricians, midwives, right? Anybody who works in this field should know that parents need extra support. They need to talk about what they're going through, and they need extra time for that. And so right now, we're all filling those gaps outside because it's not really built into most people's care providing practices. That doesn't mean all. There's many out there who do, and I work with several OBs who really do make it a point to do that. But we know it's a systemic kind of situation, right? So as we know, just a little look at the broken system that we're dealing with. The United States spends the most money in the developed world on childbirth, but has the worst outcomes, and it continues to rise, our maternal mortality. It is critical to mention, even though I think in this community and who's watching, so I won't go, as deeply into many of these points, because this actually you are all people in the maternal health field. The Black maternal mortality crisis must be acknowledged, that Black birthing people are still 2 to 3 times more likely to die in childbirth, and 8 to 12 times in my city of New York, regardless of income or education, due to systemic racism, medical racism, obstetrical racism. The national C-section rate is 31.7%, with some hospitals as high as 50 to 60%. The World Health Organization has recommended a max C-section rate of 10 to 15%. Since 1985, they've been recommending that. So we know that some people absolutely need a cesarean birth to keep their baby or themselves safe, but the overuse of our technology is more dangerous, and is, of course, creating many complications for people, anywhere from infection, return to the hospital, greater likelihood of death, and less likelihood of having that baby in skin-to-skin contact, which makes it harder to bond and connect and nurse your child. Even though there is something called the gentle cesarean birth, or the family-centered cesarean birth. And part of my work and what we do at Boober is educate people about things like that. So that is part of our, in these companies like mine, these startups that are really focused on fixing the maternal health field or dealing in this space. Part of it is that, people don't even know that there's an option called family-centered cesarean birth, and that there are several hospitals that are even starting to do this because they're seeing such great results, where they help the baby stay in skin-to-skin contact, provided the baby's fine, of course. And they can help the lactating parent or the birthing parent actually start or initiate lactation even on the operating table. And that makes a huge difference for parents, not only from the perspective, the physiological perspective of suckling creates oxytocin, which helps the uterus contract and reduces bleeding, et cetera, and helps prevent hemorrhage. And that's part of the process of that initiation of lactation, right? But also that the parent gets to bond and connect with their baby, which is really, really important. So, so just wanted to acknowledge that what we're doing is providing education. So I have a class, for instance, at Boober that's called Preparing for a Cesarean Birth, right? We have these small classes and content as well that are easy and accessible and free, or $10, that people can come into and learn all of those choices and options. So there's also no mandated home visiting after birth. There are a few programs, some states do have programs for certain income levels, but it is nowhere near ubiquitous. And it's really important when you look at other countries that both have the midwifery model of care, which we'll talk about as well, but also that they have home visitors. And that's not something that we see here. And people here have to find their own home visitor care, right? So that's something that we really need to recognize, that we could do so much better if we could get people to come to their home and help them and meet them where they are. And that is something that's done in other countries. So it can be done. And people here just literally have to pay for it out of pocket if they don't have the family to do that, right? Or the trained family or friends to do that. Most parents also have a really low expectation in this country of the experience of giving birth and nursing their children. They just, expect it because the stories are so bad for so many people. And we know that when you have that supportive care system around you, it doesn't have to be that way. We also see that only 58.3% of parents are still nursing at 6 months, despite recommendations to be exclusively nursing, breastfeeding or body feeding, which is the inclusive term. So it might be an introduction of that term for some people, and we are using it more. Body feeding has many known benefits for infants and children and lactating parents. And it's a key strategy for improving public health. But again, only 58% are nursing at all, and not even exclusively at 6 months. And there's so many reasons for that. So we'll talk about that a little bit later. And postpartum depression also affects between, 1 in 7 birthing parents, or 600,000 people in the US per year. And these stats don't even include the people who've had miscarriages or stillbirths, so who also need that support, right? And we know that if you have a history of anxiety or depression, then in general, you're much more likely to develop postpartum depression. So if we connected the dots and we put all the care providers together and we trained everybody to recognize the signs, which we're starting to do a little better on, we would do a lot better to catch what's happening during pregnancy and not wait for postpartum, right? So a lot of things to discuss around that as well. So, continuing on, some of the barriers we have, it's difficult to leave work for prenatal care, some of the barriers that are facing families, right? Can't always, depending on what your particular job is, actually leave work to go get prenatal care. And we know that if you don't have prenatal care, then you're at higher risk, of course, for various things like preterm birth, et cetera. A lot of families are spending, if they have it, thousands of dollars on complementary care like doulas and acupuncture and postpartum doulas and therapists just to meet their basic needs. And that's, again, only if you have it. There's a lack of longer solid parental leave. We don't have great parental leave in this country as compared to everywhere else. It's very bad for many, many people. And unless you're at certain companies that are starting to get a little bit better, but we're seeing it's still really, really, really diminished. So parents are working up to the last day sometimes to save those days for after the baby, which can be exhausting and unsafe in certain conditions of pregnancy. We are plagued with impersonal short prenatal visits, which is a hallmark of obstetrical appointments. Average parent has about 6 minutes to get in all their questions and have their emotions checked and all of that, if they even get that. We know that so many of our parents are leaving feeling unheard, unwelcome, unimportant, or made to feel stupid by asking the questions and trying to get extra support and care. And this is one place where the midwifery model of care, whether practiced by an obstetrician or a midwife, can help, because typically those visits are longer and rooted in a holistic approach where we're asking, how is the whole person doing? How are you doing? Tell me what's going on in your body. It's not just about blood pressure or a vaginal exam and checking that off. And then there's also the concept of centering pregnancy, which some of you may have heard of as a model, but part of the isolation of pregnancy here and postpartum, there is this concept of centering pregnancy where you bring people together for their prenatal care, and maybe you check blood pressure of 8 people in a room together while you facilitate them talking to each other and getting to know each other. So also we have that childbirth in hospitals is just highly medicalized, right? And the top technology, we have the top technology here, but it's valued over the parent's experience. And so the studies show that this technology does not inherently make birth safer. We see that we have some of the highest rates of maternal mortality in the developed world. Patients lack autonomy to choose the right positions for themselves in labor. This is huge. Patients are restricted from getting out of bed despite evidence against this. Hospital rooms lack the equipment and tools to make physiological birth easier. And they even have, a lot of them that I've been to have the tools, but nobody is using them or offering them. So that's something that can be really hard. And of course, we have the lack of breastfeeding or body feeding support in general, despite being pushed at parents as the healthiest thing to do for themselves and their baby. Our hospitals sometimes in New York, I have one lactation consultant for 50 people. This seems, I don't know how all of the budgeting works, but we could hire more people for sure, right? There are simple things that we could do. It's possible that their mother, the birthing parent's mother or grandmother, may not have breastfed due to societal influences or cultural influences, and there's no lineage then to support. So we have a lot of people that haven't nursed even though they want to. So they need more support. There is the offer of formula often over in-person lactation support, just a blanket offer instead of going, how can I help you, and sit with you and work on it. And there's also, that is, as we're talking about disparities as well, due to often racist beliefs about who breastfeeds. And the assumption that Black and brown people don't breastfeed, and so just offering formula. Absence of insurance coverage, right, leads to major disparities. And so all of that, I think we kind of covered all of what is on here, just making sure that I got through all of that. And just to touch a little bit more but behind all of these statistics, right, are these stories, these individual stories of the families. So a lot to be done, and a lot of policy work actually really needs to be done, right? And I urge you to really look into how we got here. The briefest history, I'm really not going to go into it right now, but I do encourage you to check out Shafia Monroe, who is a midwife, a Black midwife, who has a speech that's on her website, The Legacy of the Black Midwife, and understanding how, while, before the Civil War, we had midwives fundamentally taking care of of all reproductive health, essentially. And that care was interracial, and half the midwives were Black. And as slavery ended and as white male doctors really entered the field, Black midwives represented this competition for the white men, essentially, as you can read this story in the ACLU here that I put here. And as the move to professionalize medicine in general, and therefore childbirth, white male obstetricians really derided midwifery care. And they developed technology and tools to reduce maternal mortality and to aid with that kind of delivery. But we now know that doctors like Dr. James Marion Sims, who's known as the founding father of gynecology, actually gathered much of his learnings by operating on enslaved Black women without their consent or anesthesia. Dr. Joseph DeLee, and you'll see some of his quotes here, who dominated obstetrics in the 20s and really is said to have had a huge role in the intensifying the over-medicalization of childbirth, and emphasized, like, really getting rid of midwives and intervening routinely and regularly in birth to make it safer. So cutting, and moving and bringing baby out rather than standing by and waiting and seeing if there was a procedure that needed to be done. We need midwifery. We know that midwifery care saves lives, it costs less, and provides the best overall outcomes. So it's a huge part about all of these startups like mine. We're teaching about that midwifery education, that option for people. The US only has about 10% of births are attended by midwives, whereas in the rest of the world, especially in developed countries like ours, it's midwifery care is the dominant norm. And that's, everybody would see a midwife. And then if you need a surgeon, an obstetrician, you'd move to that person. And of course, midwives and surgeons and OBs all can work together in a complementary way to keep birth safe. So, midwifery is associated with more efficient use of resources and improved outcomes when provided by midwives who are educated, trained, licensed, and regulated by international standards. And that is at least what the case for midwifery from the World Health Organization says, and that midwifery should be considered a core part of universal health coverage. It's quality. Quality midwifery is central to achieving national and global priorities and securing the rights of women, or I'll add birthing people, and newborn infants. So, some of the stakeholders, we've got the new and expectant parents, the care providers. The new and expectant parents need a low barrier of access to those care providers, and they need education, and they need options. We can make education about choices and options available and affordable. If we all started moving into platforms where people are, like TikTok, Instagram, these are exciting opportunities to share your message with people. Texting, you can educate in all sorts of ways, right? But we provide a lot of education, and some of it, much of it is free, some of it's low cost. We have a different range of price points to bring people in to learn, depending on where they want to go. Care providers, they need training, marketing, billing, and business solutions and data for guiding their practices. So we have this whole world of birth doulas and postpartum doulas and lactation consultants and many more who want to make a difference, and they know their work would make a difference, but the business part's hard. And so that is part of what Boober is doing, is making the business part easy and making them get to be able to be discovered by people who need them and match them together. So we're also able to help them with creating super bills and best practices for trying to get reimbursement as we work toward this, but also really giving a career path and creating awareness around this care that is so transformative, that if more people would become doulas, more people would become midwives, we could really see a shift. So hospitals and birthing centers really need to be redesigned. The birthing venues have so much opportunity to create change, right? My grand vision is that one day we're going to have, Boober, as we continue on, we want to create birth centers that are out of hospital, but have the ability to be able to give you if you need a C-section, a cesarean birth, or if you need an epidural, but are designed as a place that, nobody's sick there. The hospital is normally a place of illness. And so I think that we can have an environment that really supports physiologic birth, but also can take care of when it shifts from the norm. And there are places around the world that are doing, these amazing kind of birth rooms that we could do fairly simply. We need policy to require parental leave, insurance coverage, home visiting, right? The government has that opportunity to do that. And mandated Medicaid, of course, mandated in coverage, especially with Medicaid expansion. So research shows that Medicaid expansion saves lives. So the American Journal of Public Health found that infant mortality rates declined, with the greatest decline amongst African-American infants. And that at a very minimum, federal law should require states to cover new birth parents who receive coverage through the limited pregnancy pathway beyond 60 days, giving it to a full year and giving full Medicaid benefits during this period, which will increase access to comprehensive health care. One of the things that we do, almost half of births are Medicaid births. And so while we haven't formalized it yet, we don't take any platform fee from people who are, who are working with Medicaid people as they're coming in to try and make that match and lower the prices significantly. And finally, insurance coverage that would, get people the complementary care. And we know that we know that doulas reduce the risk of cesarean, they increase the likelihood of nursing. So all of these public health benefits, if we would cover this by insurance, we know the Affordable Care Act covers lactation, but it's very hard to get that insurance. It's actually hard to get the coverage. So a lot of issues there, and I'm seeing time, so I'm going to speed up a little bit. I haven't given the whole thing, I realized. So just really key is to meet parents where they are, right? You'll see we try childbirth classes. We used to do them in person and bring people together to meet others. That's even more than education, it's creating community. And there's so many ways to do this. Obstetricians' offices can have meetups if they want. There's, hospitals could create those systems if they wanted, or at least be linked into all the community places that are creating this. Then you'll see in the bottom right, we also, of course, now do all of our classes virtual, live online, but we still engage and we talk and we make people feel heard. The other big thing is that people love to text, and that became a really easy access point. So using technology, texting, connecting, that just helps, right? We go to their homes. That's huge. Any in-home care makes a huge difference. So this is somebody I was helping with nursing. This is following one of the lactation counselors who's helping. It makes a huge difference. They cannot always come in. And that is why it is so helpful if we have early home visiting. So we have all these different kinds of care providers you might need along the way. And I think part of why Boober's been so helpful is because we're making it easier for the people to find the care provider, to learn about it. We're making it easier for the care providers to get to them. We are, doctors and midwives are like, oh, you can go there and get this kind of care. So there's a lot of opportunities for companies like mine, and there's many others in this space, to work with hospitals actually, so that they have a system. They could just say, oh, you need a lactation consultant, because they have them in the hospital maybe, but what about that person on day 3? And we could link into these systems to help them. And especially things like pelvic floor therapy, which is also not talked enough about in this country at all. But in France, it's you give birth and you get 8 to 10 pelvic floor therapy appointments. It's just considered part of it, of course, because you grew a baby and pushed a baby out potentially. And even if you didn't push a baby out, you had all that weight that you were holding, which affects your pelvic floor. So just really thinking about all of these amazing, I think you guys all probably know the great benefits of birth doulas and postpartum doulas, and how we reduce cesareans and likelihood of cesarean birth, and increase the likelihood of postpartum, lessen the likelihood of postpartum depression, increase the success of lactation, and make people generally feel better about their experience. So just here from the National Health Law Programs Doula Medicaid Project, requiring, this is just a little, you can read this about the benefits, especially for Black and Brown people, but requiring that doulas be certified is a racist policy that's happening right now. And we're seeing that during COVID, that a lot of hospitals changed to requiring certified doulas, especially from certain organizations. And that is creating a real problem for people who want to have their family member who could also be helping them continuously. So I just want to acknowledge that. Policy is where we need to make a lot of change, and organizations like ours are also involved in policy change. So definitely, if you haven't checked out the Momnibus bill, which is a series of all of these different bills by the Black Maternal Health Caucus, it is something to for sure look at. I'm just going to show you quickly birthing venues, what they could look like and what they do look like in other places where they have rope hanging out of the ceiling to help you. When you pull, it helps you push more effectively. A birthing tub, which we know relieves pain and makes it less likely that you'll need pain medication. Birth balls, a birth stool to be sitting upright. Look at this amazing cool chair. I mean, there's so many things that you could just do with furniture and lighting that make people feel like they're not sick and they can get up and move. And so, this is just some of how we help providers. We give them these tools, and I won't go into this right now. Companies like mine can do things like this. We provide a lot of scholarship and pay what you can programs for BIPOC care providers. Like I said before, we offer lower platform fees when matching with BIPOC providers and take no fee often when matching Medicaid parents to birth workers. We amplify, donate, and raise money for local and national community organizations. So that is something that all organizations should be doing. And then participate in reproductive justice activist groups, work on policy change. Just to show you, 1 million people are in this space right now. All these private companies, $46 billion parenting market, the new mom economy. These are just lots of the different companies in this space. But you'll see like Doula is trying to create a whole new birth center system where we birth in a different way, and it is really advancing midwifery care. You'll see all sorts of different companies in the space. Mommy is a great one to know about, a great resource, which is trying to help the doula is on the ground, and they are the first one that sees maybe that they're having postpartum preeclampsia, or they see that they're seeing spots and maybe having a real complicated problem, and they're the ones to call the OB. And so Mommy is creating a way for all the different care providers, the OB, the doula, the massage therapist who knows about the postpartum depression, actually, because they were right with them, right? So they're connecting them. And then you have to know about the Earth app. So the Earth app by Kimberly Seals Allers, I will just say, go check that out. But this is coming, and all the obstetrical and midwifery and nurses, the field should know about it. She's created an app that's like Yelp, where Black and brown people can review their experience, their doctor, their nurse, their midwife, how they were cared for. And did they experience racism in the hospital? She's trying to eliminate that. And it's a really fantastic app. And I work with Kimberly, comes and teaches reproductive justice also at our birth doula trainings. So, this is just some of our visions that we want to see, that we move into being very low in the maternal mortality, and that we have in-home visits and different leave and equal access to affordable care for all, that we move up to 50% of US births by midwives. I know that's not going to happen in 10 years, but and all of that you can see there, just some thoughts. And of course, that healthy earth begins with birth, and we've got parents and babies, and they filter out right into families, communities, and society as a whole. So I'd love to see this nation where pregnancy, birth, and postpartum is viewed as healthy. Parents have autonomy, shared decision-making. Giving birth is a natural process, so let's stop treating it as an illness and medicalize it when we need to, but connect with the parent. Midwifery-led model, birth and birth centers that equip with surgical births, lactation, decreased medical intervention, and parental leave for all. All right. Whew.
That was fabulous. I hope that everybody else got as much out of it as I did. And I have a whole list of questions that I've got on my notebook over here, but we do have some in the chat. I also wanted just to say, we put the links to Boober and the birthday presents in the chat. So if you don't see it, please let us know. Also, Francesca shared a link to dove.com, which is where Black women can get doula care paid for, which is actually one of our questions, was around insurance coverage for doula care, whether it's birth or postpartum. Kind of where does that stand?
Yeah, it is really challenging. It doesn't stand very well, I will say that. You can get reimbursed if you have flex spending or health spending. That's one way to go about getting reimbursed. Some insurance companies do provide some level of reimbursement. The more argument you have to have, you can have a letter from the doula. Boober can initiate another letter. You have to go up the chain with them to explain how having a Boober, not a Boober doula. Don't worry about that. Sorry, having any doula reduces your likelihood of having all of these interventions, which cost a lot of money. So we expect eventually insurance companies to get more and more behind this. Medicaid is coming more and more behind it. We're trying to get Medicaid coverage in New York. There was almost Medicaid coverage for doulas, but the doulas rejected it because it had many complicated problems, like only paying $600 to the doula, which included 6 visits and the whole birth. So you were supposed to go to an entire birth and do 6 hours of care. And many of these people are parents themselves and need to earn a living wage to do all of this. So that is just incredibly important. And so we're all working on this and hope to see more of that. We are starting to see companies like Dove. I just saw that. And also Walmart partnered with the National Black Doula Association, which was really exciting to see recently. So finding places like that, I think the more people that go to their own employer and start to bring these things can help. But yes, it's not fully covered by any stretch yet.
Thank you so much. From our audience and our participants, I just wanted to see if any of you had any questions that you wanted to ask. Wanda, I saw you put in the chat that you are a WIC counselor and also a lactation consultant. And didn't know if you had any questions for our speaker or anybody else.
I also see a few questions actually.
Yeah, there's quite a few in there. I just want to
maybe I'll just glance at them real quick. Did you get pushback or resistance to the fact that you had not given birth at the beginning of your doula journey? I didn't, but I was partnered with my doula partner I met in my doula training. She was 10 years older than me and had a child. And so I was quite young, I was 24 and didn't have a child. And so I think our partnership may have helped me in the beginning. I also think there's something amazing about not having a kid and doing doula work. You don't have anything. I was very free after I had my child. It became harder work to be gone for all of these hours and be thinking about my kid and stressing out on that level, to be quite honest. So it's I think I was able to really share my passion and enthusiasm and make people want to be there. So not too much. Is Boober available in any other languages than English? There are care providers, absolutely. Plenty of the care providers speak different languages. We just did our first Spanish CPR class last night. We do a 1-hour webinar. So we will sometimes do that. The care providers come in all different languages. Somebody asked about if it's available only in New York City. It is. We started it and we're based there for most of our in-person care, but we do lots of virtual care. So at this point, we didn't. Before the pandemic, we were all in person, but now that we are able to do that, yes. So it is available in many places, and we're always we're starting to find more people in different locations. So we will always try to help somebody find care, even if we can't match them ourselves. So definitely we can reach out about that. I think somebody asked about body feeding. Sounds like a synonym for chest feeding. Yes. So it's the most inclusive term from the LGBTQ, community that is being used currently. And it's a little broader than chest feeding. But essentially, as some people would say breastfeeding, or as a cis person might say breastfeeding, somebody might use the term chest feeding or body feeding. And so we try to use, many different terms, and we always want to find out the term that the person uses themselves, their pronouns, et cetera, to be able to support them.
There's a couple other questions in here that are really, really wonderful. And I think this is one thing that we're really trying to hone in on is the question here talks about any tips to how to communicate with hospitals to ensure they see doulas, and I will say midwives, as part of their care team. So if there's, 2 or 3 things that we could do as people working on the ground all over the country, what are those recommendations that you have?
Yeah. Well, especially with care providers, one thing as a doula, if I had somebody hire me as a doula, then I would always ask them, can I come meet your doctor? Can I come to a prenatal visit? That way I could connect with them as a person and explain, who I was or my role and how I was. So that's one thing that I think can be really helpful. Any kind of education in services. My doula trainer, Deborah Pascali Bonaro, who is amazing and does all of our doula trainings, and she gets hired regularly actually by hospitals to do in services, et cetera. So you can bring in people, something I could do is do an in-service for the people who get it. And I think, that way, when it's through the hospital, it becomes part of the system and is a great way to connect as well. I also always I walk into, well, before COVID, haven't been walking into offices now, but I did used to walk in all the time and try to get a moment with a care provider just to explain and really explain our role as not taking over, the care provider's role, but that we're really in support of our, the birthing person.
Great. I've got a couple of questions here, and I want to go back to something that you said very, very early on, is that you mentioned how important presence was, and that it's the presence of the doula, the family, the friends, the people that are there, and to being 100% in with the person who is birthing. And I'm wondering, COVID's been hard, and I don't really want to talk about the Debbie Downer part of it, but what have you learned about presence in birthing from COVID that we need to keep?
Yeah. COVID, of course, hard in so many ways. And one of the things actually that happened with Boober, one of the reasons why I think, expanded so quickly is during COVID, when doulas got banned from the hospital, and actually when partners got banned, that happened first, at least in New York, right? I don't know if it happened everywhere, but I know right here where I was, partners were banned, and there was this complete freak out, of course. And I threw together a confident hospital birth by yourself. What does that look like? Solo birth, I think I called it, in the hospital. And I just made a virtual presentation. Actually, we ended up having, I think, almost 1,000 signups. I shared it with a bunch of people that I knew, and people were just like, what do I do? And so one of the things I talked about was connection can be virtual, actually. And I was the last person, by the way, to believe in virtual care. I should just say that really clearly. I was never going to have virtual care as part of Boober. I only believed in in-person care. And I was like, nope, we're not going to be doing this all the time. Right. But when you can't have the in-person care, this is the next best thing to connecting with somebody and being with somebody. And we were able to, that care support, having, I did postpartum doula care as well, virtually, for people. Cause I actually, before I would sell it, I wanted to see what it was like, and people needed it. And I was doing it, and it was amazing. It's sort of like, I could pop into people's homes for an hour. They could ask me all their questions about their baby. I could listen to them cry. I could help them breastfeed through the screen. It was amazing. I didn't think we would be able to do that. And I think that it helps us stay in connection when we're not able to see people in person. And so I would do it over not doing it. And I would, the satisfaction that came in, like, I was really surprised. I think 95%, maybe 97, it was something between that, I forget the stat, of people who had lactation visits even were just like, amazed and how we could solve their pain. A few people we couldn't, right? There were a few things that had to physically be done, but with doula care, especially, we found a lot of virtual doulas ended up not always doing screen, but actually just the birthing people would wear their earbuds in their ear, and the doula would be whispering in their ear, keeping them calm and like listening to what was happening in the room. They would know when, the person was done with the contraction, because you make a sound, and we could hear that and be like, okay, now it's coming down. And then you could hear what the doctor would say. Okay, why don't you ask this question? And so we were like this little voice, which is pretty cool. So
very, very innovative. And really, we, many of us worked on an innovative telehealth project during COVID, and were able to provide some funding across the country for different innovations like that. So really amazing opportunities. Another question that I have for you is talking about the reproductive life continuum, which I completely agree with, and I think we all do, that it is very siloed. And I always think about when I gave birth to my first child, I was in, chronic disease, HIV, STIs. And had I known then what I know now, I would have done things very differently. And so I'm not sure if that's a good thing or a bad thing, but, I didn't know doulas were an opportunity. I didn't know a midwife was an opportunity, that, and I was 30 years old. So when we think about this continuum of holistic care, I'm wondering how you kind of work in ideas around preconception and interconception health, either in your teaching and education, or with your patients and your clients, because it is really part of this, that if we don't get them until they're pregnant, we've missed windows of opportunity.
yeah, we definitely have. I mean, that's where, and I haven't done it yet, but like, I want to go speak in colleges. That's where, I want to be talking about to 18 to 22-year-olds. I mean, I have these 4 girls right now, right? So they are living what I'm living. They're now that it's virtual, my work is not out of the home anymore. And they are hearing me talk about all of it constantly. In addition, so they hear, midwifery care, or they watch me latch on baby dolls all the time, and they're not watching the private one-on-one things per se, but they're watching me teach a lot and just being exposed. So I think the more we talk to our kids, first of all, whatever your, doesn't matter what child person you have, it's all part of the continuum as well, right? And so talking really openly about it. I mean, even as I'm buying endless period products and underwear and all of this, and also, as I'm getting older and going to be moving toward menopause, and talking about that with them, like how crazy you guys are getting your period. I'm gonna, be stopping my period at some point. And it's like just really just talking about it, so that it's normalized. And then, I think we haven't deeply gone into all of the preconception content yet, because we're more known for what we're known for. And of course, there's so few of us working on it, but it's definitely in the list of things for sure, to like keep backing it out further away from just the pregnancy and birth, and then going further as well, for sure. So
that sounds great. Well, we are just about out of time. I just wanted to give you the floor to just see if there's anything else that you wanted to share with our participants and the audience that we're going to be sharing the recording with, and to thank you for your time. So any last and final words?
Thank you. Yeah, I just would love for anybody who has, a pregnant person in their life, or a new parent who's struggling, to know that Boober is here. We have all these different classes that are online, but they're live and interactive. We're working on pre-recorded classes, but I always want to keep that live interaction. I think it's really, really important to engage, and that we can, connect people to doula care, mental health therapy, pelvic floor therapy, all of that. I would love for people just to know that we're a resource, and especially in lactation, when you're in crisis, resource. If virtual works for somebody, I mean, we can help you within a couple hours, which is really helpful. And I hope that I will be able to potentially partner with other organizations, especially community organizations, if they need some of the infrastructure or technology, that we could, get that working together. And I hope that hospitals will also really want to move into that parent-focused, centered way. So any connections that we can start talking together and collaborating to make this better.
That is awesome. And I just want to remind our participants that the recording of this will be up on our MHLIC maternalhealthlearning.org.com, I believe, or .org. I never remember. It'll be there. And so please share it with your colleagues. And we just thank you so much for your time and for all that you're doing. And please stay safe. We do know that Ida hit you all last night, so please stay safe where you are. Thank you for sharing so much information. I learned a ton, which is always awesome.
I'm so glad. Well, thank you so much for having me, and hopefully we can connect in other ways. And,
yes.
Jada, that was wonderful. So sorry, my internet just crashed right at the end of that. But I want to come back to catch you and say thank you so much.
Yeah, thank you. I really appreciate the opportunity.
This is great.
Yeah, if there's any other way we can collaborate or connect, please let me know.
I think definitely we will be in touch. Thank you so much.
Yeah, thanks for your work. Okay, take care.
Bye. Thanks, Allison, for making it happen.
Thank you, Leslie.